All right, I wanted to give a summary of what we learned today at the it's about advanced care and advanced decisions, but it's really about advanced directives. And so these are the documents that you write and give to your family members and possibly to your doctors to be able to inform their decisions about what it is that you would like to happen to you should you have a heart that stops or you have a problem in surgery. Do you want to be resuscitated? How and in what manner can they speak for you when you can't speak for yourself? It was here in Pennsylvania, and it was supported by a number of organizations to help inform the community that these directives need to be written. But the thing that is often missed is the age group. Not surprisingly, most of the individuals who attend these informative sessions are much older than myself and others, but it is so important that everyone of every age thinks about what is it they would like to be decided for them should they be in a position where they can't speak for themselves. And so we talked about not only what happens when you are at the older age, but also how it affects the children and family members who have to make those decisions. And then also about some either children or others that have illnesses much younger than expected and how it is they can have these discussions with their doctors. One of the things that we talked a lot about were caregivers and how much stress and strain is placed on them to make not only these decisions in high stress emotional states, but also that those decisions may be different than what they would make for themselves, and how difficult it can be to honor the wishes of the individual who is affected. And it's also interesting to note how funding works. So we talked with some folks from Central Pennsylvania Hospice, and we talked about particularly Medicare. And they noted that it's only the last 6 months where there is real reimbursable options. And yet there are people who are in a kind of in-between state, if you will. They know they have an end-of-life disease or ailment, and yet can't get the care for wellness during the time that they need it unless it's to that very final stage. And so we learned a lot about palliative care. If you haven't heard that term, Google it. But essentially, it's that time prior that can help to keep people where they need to be informed and work with teams, social workers, pain management, hospital workers, a team of individuals that can really help you make decisions along the way for your children, for your family, for even if you have to continue working during that time. These are hard discussions. They are not something that come up in politics very often. They are not things that we discuss comfortably, and yet they're necessary. They're necessary at every age. They're necessary in government policy. They're necessary in healthcare. And we need to think of the entire system. That means the entire system of the human. So not just treating one of the doctors says in our effort to treat the disease, we sometimes forget the whole person. And we need to think about all of those pieces. But also in trying to treat the patient, we sometimes forget all of the family members and caregivers that are involved. And each of these elements needs consideration for time away from job, for caregiving, the stress and strain that can happen, and the mental health costs that can occur based on issues that one patient has. It's a lot. It's a lot to digest. It's a lot to take in. But as we think about a national healthcare strategy, it's absolutely necessary that we also incorporate these pieces. So if you haven't filled out your advance directive, definitely go online. You can Google them. They take your signature and 2 witnesses, and that's about it. So don't hold back and don't wait. If you're over 18, it's a great thing to do.